All right, so last week we posted a little bit about what I am doing as a plastic surgeon in my early 40s to look my best into the next decade of life. And today I want to talk about the things that I'm absolutely not doing and will never do as someone, as a plastic surgeon, and as someone who has signed on to the fact that in order to look my best long term, I'm eventually going to need a facelift. And I want that facelift to be easy for my surgeon to perform and to produce a long-lasting good effect, and I want it to be as low risk for any type of complication as possible. So those things are things that can disrupt the normal tissue planes of the face. So we have to elevate the face and neck in order to pull back on the SMAS or the layer underneath the skin, tighten that, the platysma, the muscle in the neck, tighten it to give you a sharp jawline, and then we have to redistribute the skin. So things that disrupt the normal planes that we elevate are going to be things that melt fat non-selectively, like Kybella, heat energy devices that deliver high levels of energy underneath the skin via cannula, things like FaceTite, things like Renuvion in the submental and neck area especially, or along the jawline. All therapy is another one. Fillers that are biostimulatory fillers, especially done by someone that is not going to be doing my facelift, because these biostimulatory fillers cause your body to form collagen, but collagen is also scar tissue. Normal collagen that we all have in our skin, underneath our skin, that's laid down, is not exactly the same type that these biostimulatory fillers cause. And here is a photo. It can make a facelift extremely difficult to perform and to find and identify the normal anatomy, which can make it more dangerous for complications like nerve injury or damage to the skin if you're in the wrong plane. In addition, threads, either permanent or PDO, they're done blindly. They can break and cause an uneven result, and then they cause scar tissue to lay down in places where you really just don't want it to be. So I highly recommend that if you are considering doing any of these things, that you visit with someone that is capable of doing your facelift, someone that you would want to do your facelift, who has good results and who you trust. And in their hands, if they're not going to do those procedures and they're not going to offer those procedures to their patients, it's probably not a good idea, and it's for good reason. Thanks for watching. Be careful out there.